Hi, my name is Ellen Strunk. I'm president of Rehab Resources and Consulting, and I'm also a NARA member. So I'm here today just to provide a short brief on the proposals in this year's skilled nursing facility rule on the value-based purchasing program. Currently, the SNF VBP program has 5 measures, and in this year's rule, they propose to add some additional measures. So first off, they want to refine the SNF potentially preventable readmission measure specifications and update the measure name. They want to add the total nurse staff turnover measure. They want to add a percent of residents experiencing 1 or more falls with major injury. They want to add a discharge function score measure, the same one that's also being proposed for the SNF Quality Reporting Program. And then finally, add the number of hospitalizations per 1,000 long-stay resident days measure. So for the SNF PPR measure specifications, what it currently reflects an all-condition risk-adjusted potentially preventable readmission. And since adoption of the VBP, CMS has engaged in additional measure development work, and this proposal will further align the measure specifications with potentially preventable readmission measures in other programs. So the numerator would only include unplanned readmissions that occur from the date of the SNF admission through and including the date of discharge. So any hospital readmission that occurs within the SNF stay or a direct transfer on the date of the SNF discharge, but it does not count planned readmissions or readmissions to inpatient psych facilities. The nursing staff turnover measure is a structural measure, and it uses the PBJ system to calculate annual turnover rates for nursing staff. And that includes RNs, LPNs, and nurse aides. And turnover is identified as a 60-day gap in the days worked. The falls with major injury measure is an outcome measure, and we're familiar with this one because it's currently included in the SNF QRP, the NHQI, and the 5-star program. And then the number of unplanned inpatient readmissions to an acute care hospital or critical access hospital or outpatient observation stays are included in the long stay resident per 1,000 long stay resident days readmission measure. So that definitely is a mouthful. Now, each of the measures could earn up to 10 points. And so essentially what that means is that if all of their proposals are adopted, we would have 8 total measures in the VBP. We have the potentially preventable readmission measure that is currently in there. We have the healthcare associated required infections that looks at calendar year 24, in addition to the nursing hours per resident day staffing and the nursing staff turnover. So those 3 would be added in calendar year 24. And then the following year in calendar year 25, we would get the discharge to community, the falls with major injury, the DC function score, and the long stay hospitalization measure. Now, the other big thing in this year's rule for the VBP is the health equity adjustment. Now, this is big because it's a brand new kind of bonus opportunity, but it would be calculated using a methodology that considers both the SNF's performance on the VBP measures, as well as the proportion of residents that are dual eligible in a given program year. So to be eligible for these HEA, health equity adjustment bonus points, it looks at the SNF's performance would have to meet or exceed a threshold, and its resident population during that applicable period would have to include at least 20% of residents with a dual eligible status. So the rule is jam-packed with VBP proposals, and it's more evidence that CMS is moving further down the road of a payment system that's heavily influenced by the outcome of care that a SNF is able to achieve. So happy reading.